I was reading a wonderful article today by Dr. Mercola. He was interviewing Dr. Patrick Gentempo, a chiropractor, and they were having a discussion about the core pillars of wellness. And I found this very fascinating as I read this. It was explaining, how the pillars of health, what are they, right? And so one of the pillars of health is nutrition, right? What you're putting in your body, the building blocks of your body. Rest was the second one. Yes, how are you sleeping? That's going to be important. Restoration, rebuilding. The third one is movement, because it doesn't matter if you do the other things. If you're not moving, you're not sending a message to the body to use the muscles to stay alive. And the last one, but not any less important, is emotional health. And as I went through all of these, and they were having a great discussion on this as well in this article, Understanding the Foundations of Health is what the article is called, by Dr. Mercola. I thought about some of the things they were talking about in terms of belief systems, because as we've heard from Dr. Lipton uh, about subconscious beliefs and where we learn our beliefs from and how young we are when we learn these core beliefs. And many of us, have learned our belief systems, the core of them, from a very young age. From the time we're born to 7 years old, some of the most pivotal belief systems are formulated. And so many of us are walking around with belief systems that we developed, learned, that infiltrated our minds from a very young age, before we even knew how to decide or to understand our own free will. And then later on, it continues. It's an ongoing onslaught of marketing that occurs that hijacks the mind. So we have to really look at our belief systems, because we can't, it's going to be very, very hard to make positive changes in one's life if one has a tape playing in the back of your mind, which is your belief system. And if it's saying that, I don't matter, it's going to be really hard to actually incorporate any type of self-care consistently across the board. I believe that the emotional health piece, the mental health piece, really needs to be addressed first. Because what I have seen is that no matter what the best effort that a person has, if they can't change that tape that's playing, that core belief that's playing in the back of the mind, in the subconscious or the unconscious, it's going to be hard to maintain and sustain healthy habits. Or there's going to be a self-sabotaging that's going to occur, where the supplements won't even work. The body won't be able to even absorb and assimilate good things, because there's this tape that's rejecting healing, rejecting joy, rejecting love, right? So I think it's very important for people to really start with the mental health. Even though all of these things are important, nutrition, rest, movement, emotional health is the main driver of how a person shows up in their own life, how they show up in other people's lives. And if they're capable of truly, I believe, reaching their highest level. So I think it's important to work on not just trauma, but just get connected to a mental health provider, a licensed mental health counselor, psychologist, to figure out what the tapes are that are playing in your mind. What's the belief systems that are driving you? Because they could be conflicting. It could be two different belief systems. And so there could be a sabotage that's occurring. And one would not even know it in some cases. So I think the first stop is to really check and see what it is that you learned about everything. Money, wealth, health, relationships, friendships, people, society, the world. And that's going to take time. That's going to take one-on-one time in a relationship with a mental health provider to learn more about yourself, to gain the self-awareness, and to do the work with some evidence-based interventions like EMDR or internal family systems, for instance. Those are the ones I tend to use most to really get to the different parts of you that have different stories, different narratives, and could be in direct conflict with each other. Get to the tape that's playing in the back of the mind so that one can access it and one can change it to a more adaptive belief system, a more healthy belief system that can support you in nutrition, support you in knowing that you deserve to rest, support you in moving out into the world, walking, connecting to others in a healthy way. So this is something to truly consider, as many people don't often work on their mental health. They kind of chalk it up as, some not necessary because maybe they don't identify as someone who has a diagnosis. But these core beliefs don't require a diagnosis to still be ruining your life or sabotaging your life in some way, shape, or fashion. Okay? So that's my tip. My tip is to get connected to a mental health provider. Start digging a little bit deeper to see what your belief systems are and how you approach things in the world. Because a lot can come up for you, and it can be only helpful in helping one to be able to implement the other areas, the other pillars of health, such as was mentioned: rest, nutrition, movement. This is a big deal. I wish you well. Thank you.